Hi everyone. Today we're going to discuss an crucial topic of total hip replacement, which means TKR. I'm Dr. Abdul Tawfiq from the SNS College of Physiotherapy. I'll be talking about these topics, a surgery that has transformed the quality of life for the millions of patients worldwide. Shall we start? Introductions. Total hip replacement or THR is a life changing procedure for the patient with severe hip joint disease. It relieves pain to restore the mobility and also the patients to return to its independence. Among with the knee replacement, along with the knee replacement, it is considered one of the most effective and successful orthopedic surgery. Coming to the definition, the patient problem. Definition of the patient problem. Definition: THR is also known as hip orthoplasty. Involves removing the diseased femoral head and acetabulum and replacing them with artificial implants. But before we look to the procedure, let us emphasize with the patient they often live with deep groin or hip pain, stiffness, and difficulty in simple actions like walking or sitting. Even sleep becomes disturbed while this infections or the THR is needed when it is needed. Um, Over the time, this constant pain leads to dependence on the others, loss of social participations, and emotional stress may be included for the patients, which has been for indicated for THR. The causes of hip pain or hip damage, anything else. The most common causes osteoarthritis, the degenerative wear and tear disease. Other causes include rheumatoid arthritis, avascular necrosis due to a disturbed blood supply, most traumatic arthritis after future or fractures or dislocations, congenital hip dysplasia, and in some cases, infections may be too. The indications of THR. The THR considered as severe hip pain, not relieved by medications or any physiotherapical or any management. Restricted range of motion in the hip, interfering with daily living activity, daily activity, active daily living activity. The deformity or conservative treatments are main indications for ultimately the decision is taken by patients, and the patient's quality of life has been significantly destroyed. What are the goals? The goals are clearly relieving chronic pain, restore the hip alignment and function to improve the mobility and balance. The most importantly help the patients to regain their independence and confidence in daily and social life. What are the non-surgical management? The non-surgical management are before surgery, the patient are managed with non-surgical methods, medications like NASIDs and DMATs, the physiotherapy for strengthening and range of motion, walking aids such as sticks and walkers, the injection like steroids, and lifestyle changes such as weight management and reductions. These methods are helpful in earlier stages but rarely insufficient of advanced diseases. When the TKR is necessary, which means the indications of TKR, the importance to know that when THR should not be done in earlier arthritis with mild pain, younger patients, where the joint is preserving the options, or better patients with severe and medical problems, or those unwilling to follow post-operative rehab, which means THR. After the THR is avoided, so carefully selection of patient is more critical than any other. What are the surgical alternative? The surgical alternatives include hip refurnishing for younger and active patients, osteotomy to realign the joint, or hip hemiarthroplasty where only the femoral head is replaced but in advanced and widespread hip disease. The total hip replacement is a gold standard surgical procedure to be performed. What are the pre-operative preparations? Before surgery, we ensure that patients is well prepared. Medical history, blood test has been done. The clearance of physicians and anesthesiast and surgical surgery is obtained. More importantly, then patient undergoes the pre-rehabilitation, strengthening exercise for hip and core muscles to be speed up recovery. The counseling about risk, benefits, or expectations are equally essential. The surgical procedure, step one, under the anesthesia, an incision is made by using the posterior lateral or anterior approach. Which side the incision may need to be get sutured. The diseases of femoral head is removed and acetabulum is cleaned and reshaped. The acetabular component, usually a metal cup with polythene or ceramic linear, is inserted. The femoral stem and head are implanted either cemented or cementless and wound and proper dressing. Processes are variant cemented versus cementless fixations and different weight bearing surfaces of metal and polythene, ceramic or non-ceramic, or otherwise technique can be traditional, open, minimal, or invasive, and robotic assisted surgeries. What are the complications? The complications are possibly early ones include infections, blood clots, and dislocations. Long-term issues may be involved by implanting, loosening, wear and tear components. Rally nerve injury or limb length discrepancy can occur, however, with carefully surgery rehab and follow-up. These risks are minimized. Long-term goal. What are the long-term goal? THR has been globally successful rate of 90 to 95% of with implants lasting of 15 to 25 years of physiotherapy ensures that stronger muscles stabilize the gait, stable gait and independence. The most patients can walk and climb stairs and return to the recreational activities. To conclude that total hip replacement, not just in surgical procedure, but also life restoring solution. It combines surgical expertise, patient care, and the physiotherapy to transform the pain, disability into mobility and independence too. Thank you. Hope you all understand.